Welcome to the Beyond Face Value show with Dr. Jill Wade. I'm your co-host today, Laura Lewis Edwards, and I love being here with Dr. Jill. And today, what we're going to be doing is talking about your oral health, your brain, and your heart. So, welcome to Dr. Jill.
Thank you.
To this amazing set. We love our set.
I know. We love our set. It
We
feels
love
so homey.
Our beautiful, wonderful logo there. And I'll just say it out of the top. Just if it's your first time watching, you can watch us on YouTube. You can also listen to this podcast on any of your favorite podcast platforms. Just be sure to search for the Beyond Face Value show with Dr. Jill Wade, and you'll see all sorts of wonderful episodes. But today is not going to be any different than the rest of them because we always talk about some really cool stuff. And in a previous show, we were talking about oral health, the importance of toothbrushing, how even brushing your teeth twice a day can extend your life, which it might sound rather dramatic, but this is true. This is real. And today, and I brought my nerdy self again, Jill.
I love it.
I had to.
Please do.
I brought the nerdy self again because we're going to talk about this oral health and brain connection. And oral health and heart. And I know we've talked about heart and heart disease in another episode earlier, but this one we're going to touch upon some very specific things that are associated with your oral health and these very important internal organs. So, anything you want to say out of the chute?
I'm ready.
You're ready.
I'm going to hold back for a second.
Okay. So, basically, if you haven't really thought about this before, that brushing your teeth, keeping a healthy mouth, has something to do with your brain. Well, we're going to enlighten you today because there's actually been research studies that show an association with your brain and your mouth and the number of teeth you have or how healthy your mouth is and how the size of your brain. Now, if that isn't a great teaser, I don't know what
I was going to say.
We're just teasing that great information to say, wait, okay, hang on. What did you just say? You just said that the number of teeth I have in my mouth or how healthy my mouth is could impact the size of my brain and it could shrink. Okay, so let's talk about this. Taking good care of your teeth, it could be linked to better brain health. That's according to a study published in a July 2023 online issue of Neurology. It's a medical journal for the American Academy of Neurology, a study of nerves and the brain. So this study was conducted at Tohoku University in Japan, and they found that gum disease and tooth loss were linked to a brain shrinkage in the hippocampus, and that's where memory is, and Alzheimer's disease also originates. So the study involved 172 people. They were an average age of 67, and they didn't have any memory problems at the beginning of the study. And participants had dental exams, as you would think they would, Dr. Jill, and they took memory tests at the beginning of the study. And they also had brain scans to measure the size of the hippocampus, the part of the brain, again, that has to do with memory, learning, and emotion, at the beginning of the study, and again, 4 years later. Okay? So that's a really interesting study, right? So for each participant, researchers counted the number of teeth they had in their mouth, and they also checked for gum disease at the very beginning and looking at like periodontal probing depth that
Oh, yes.
When we go
numbers we count.
When we go to the dentist and they're poking in your gums and they say 2, 2, 3, 3. Oops, that's a 4.
Right.
Okay, I don't want to ever hear 4s, and we want 1s and 2s, right?
I love 1s and 2s.
Okay. After adjusting for age, researchers found that people with mild gum disease, the increase in the rate of brain shrinkage was due to one less tooth in participants' mouths was equivalent to nearly 1 year of brain aging. Okay, I'm going to say that again. So if they lost a tooth in their mouth, one less tooth equals 1 year of brain aging. Now, I don't know if our listeners or viewers have ever thought about that before, but there is an association with that, where if you're losing teeth, it's actually going to shrink your brain, shrink your hippocampus. So what do you do about that? But there's another thing they said. They also had a part, conversely, they said that there's an increase in shrinking of the brain due to one more tooth in the mouth. If they have a lot of teeth, but there's gum disease, then they're going to have even more brain aging. So that's like a flip side. So so either you're going to lose a tooth and your brain's going to shrink. We don't want our brain shrinking.
No.
We don't. Or if we have a lot of gum disease and there's a lot of teeth in there with lots of gum disease, you could even have more brain aging per year. So really, to put it simply, and this is according to the guy, the doctor, Dr. Yamaguchi, who is the lead researcher in the study, he said, these results highlight the importance of preserving the health of teeth and not just retaining the teeth.
Mm-hmm.
The findings suggest that retaining your teeth with severe gum disease is associated with brain atrophy or shrinking of the brain. So really, what he said is that controlling the progression of gum disease through regular dental visits is crucial, and teeth with severe gum disease, they need to be extracted and replaced with appropriate prosthetic devices. So that's a lot of very scientific talk, but it's really important because of this association with if you end up losing your teeth and not replacing them, either with, you might just have
A partial,
which, yes.
dental implants.
Yes.
Nothing. I mean, even nothing is an option.
Well, but to have a full mouth with, like if you have dentures, for example.
Exactly.
Because what they really are finding, and this is what I've read, and I'm not the expert here, I'm just a nerdy researcher, right, who loves stuff and loves health, is that it's better for you to have something in your mouth, because when you have something in your mouth and you're chewing and because it has to do with your brain.
Yes.
Now that blows my mind.
Brain and gut. See, I see it going both ways.
Yes.
Because if you don't, our chewing and our digestion starts with chewing. And so if you don't chew your food because you don't have any teeth or partials or dentures or implants or anything in there, then you can't actually start the true starting point of digestion. And that's chewing, mixing with the saliva, and certain parts and pieces of that happening in the mouth before you ever even swallow.
And I love that you think that way. I love that you're a holistic wellness dentistry, wellness oriented individual, because you think totality, the total system.
Absolutely.
But yeah, I mean, so it makes you think if you know someone that has lost some teeth, and they think, it's okay.
Right.
I mean, the least they can do is hopefully try to find a way to get a bridge to replace that, because it does have to do, as you said, with chewing optimally, as well as brain stimulation. And then, of course, the flip side is the worse your gum disease is, especially as you age, can really cause that brain shrinkage and cause memory problems, learning problems, and all that kind of thing. And so I just think that's excellent food for thought.
It is. I'm going to make 2 big points on what I just heard you say, which was a great study, by the way. So one tooth being infected and needing to be extracted or taken out because it's sick is very important for your body. You do not want an infected tooth to stay in your body. It's like a splinter that needs to be taken out. And as soon as that needs to be taken out, the healing can begin. So it can happen that you don't have periodontal disease. You do have one tooth that is a problem and has an infection, and you need to lose that one tooth, kind of like what the study was saying.
Right.
If you need to lose the one tooth, it's okay.
Right.
But it's worse if you have a lot of teeth and you have a lot of the teeth having periodontal disease or gum disease, or what my grandmother used to call trench mouth. I mean, it's been named a whole bunch of things over the years, right?
That term.
But the thing is people tend, when they have periodontal disease, to want to try to keep their teeth. Not necessarily try to treat it, but they also want to try to keep their teeth. It's actually almost worse for them, just like you were describing.
Right.
And I'll kind of briefly explain it, because when you have periodontal disease around multiple teeth, like maybe 28 teeth or 30 teeth, it's happening all the way around, 360 degrees around every single one of your teeth. Okay? Now, that doesn't seem like that would be a very big surface. Okay?
Right.
But when you add that all together, you could put, I always say my knee for some reason.
Okay.
You could imagine a skinned up knee, a very open wound that you would clearly go to the hospital or to the doctor to have that wound cleaned out.
Right.
Because it would be about the size of a baseball.
Okay. Which the surface
Surface
area and the mouth, that if all the teeth are infected, it's about the size of a baseball. Okay.
And it would be as if you had a huge, opened, diseased wound.
Okay.
You would never, ever in your life, not think about going to the hospital to get that taken care of
Right.
and cleaned out.
Right.
But yet, because it's in the mouth, you don't see it. Periodontal disease isn't painful. It doesn't itch. Yes, it might swell, and yes, it might bleed, but for some reason, when it's bleeding, it's still not painful.
Right.
So patients can tolerate it, and they can tolerate it for a long time, years after years after years. And they may lose some bone and notice that their bone loss is happening, but because it doesn't hurt, they'd rather hold on to their teeth, right?
Right.
So they can chew with them.
Right.
Who doesn't want to chew their food?
Right. Or have their
Or have a smile.
Right. Exactly.
But your beautiful research there shows the reason why
Right.
very clearly.
Right.
It's about the bacteria, the really bad bugs that live around the teeth, get into the bloodstream, and go across the brain barrier. That's the key. That's why it's affecting the brain.
Yeah.
Because not everything that happens in our body actually will cross the brain barrier.
Right.
But these bacteria will. And specifically, the research shows it's this, I hope I say it because I'm going to get a little tongue-tied today, but Porphyromonas gingivalis, what they call PG. If you look that up in the science, it's PG specifically. That is what is really the research is all about in dementia and Alzheimer's.
Yes.
Okay.
Right.
And interestingly enough, we also deal with PG, one of the bad boys, when we are dealing with 4 different really bad bacteria for heart disease.
Right.
Okay.
Yeah.
So we've got heart disease over here being caused by PG. We've got dementia and Alzheimer's being over here affected by PG.
Right.
Okay. So guess what, in dentistry and even in medicine to some extent, we definitely call it this in dentistry. But do you know what we call dementia and Alzheimer's in dentistry?
What?
Type 3 diabetes.
Oh my goodness. I did not realize that.
We call it type 3 diabetes all the time because it affects diabetes when it progresses. And people are used to hearing about like diabetes feet or diabetes fingers, where if you've had diabetes and it's really been uncontrolled for a long time, it can make some of your extremities and the smaller blood vessels, not the big ones, but the smaller blood vessels really have trouble. And so people will get numbness in their feet and toes, maybe even lose toes and fingers and things like that when they're really out of control with their diabetes.
Right.
But it's the same type of situation in the brain. The small vessels in the brain is what starts and causes the dementia to then move into Alzheimer's and all these kinds of things. So it's so connected.
It is connected, and
The brain's connected to the mouth's connected to the gut.
and the
connected to the
PG, you call it
everything.
PG.
PG.
The PG is a bad boy bacteria that
boy
you'll find in
bacteria.
the mouth. I had also learned that I know that they find with Alzheimer's patients post-mortem
Yes.
find that bacteria in the brain.
Yes, they
I mean, it is directly correlated.
Directly.
So there's another, and you were talking about the heart, which is something I wanted to cover real quickly. We've got about 5 minutes, I think, to talk about this, but this could be a whole show, a whole
my
episode
gosh,
too.
yes.
But it talks about, I wanted to dive in real quickly about, awareness of the connection between the heart and oral health really was firmed up in 2007, apparently, by the American Heart Association. Okay. And they started encouraging people, for example, who had pre-existing heart conditions to take antibiotics before certain dental procedures. Correct? I mean, I had just heard that question to me recently when I was going to get a root canal. And they were like, do you have
any
pre-existing heart stuff? And I was like, wow, that's really interesting. And I didn't really know that. With my father, who had passed away with heart disease, and I know he had oral health problems his whole life. I wish I'd known this. I don't know if he would have listened to me, but that's another story for sure. But infective endocarditis, and for those listening, I am just listening, not viewing. I am reading this stuff on my phone here that says it's also called bacterial endocarditis. It's a heart infection caused by bacteria that enter the bloodstream, settling in the heart lining, heart valves, and blood vessels. So what they have found is that this is really interesting. That the thing that I found was that they found that regular toothbrushing and practicing good oral hygiene was as effective for those patients as antibiotics.
It's certainly a big part or piece. Absolutely.
So they said, this is what they found. They said, and conversely, they said with these type of heart conditions, if they had poor oral hygiene, they had a greater risk of developing infective endocarditis. Not even related to a dental procedure.
The heart.
Yes.
Sometimes to the point, of no return. Now, heart disease is reversible to some extent.
Right.
But once the damage to the heart actually happens in long cases of endocarditis, we're talking major surgeries to get that corrected. So major surgeries.
So you got to know, and you got to remember that oral bacteria and the oral systemic can infect your heart and cause problems. Here's on another note talking about this, Dr. Jill, is that with matters of the heart and oral health, is that brushing teeth frequently is linked with lower risk of atrial fibrillation. I can't say it right now. AFib, and heart failure. And that's according to a study published in the European Journal of Preventive Cardiology. And previous research suggests that poor oral hygiene leads to bacteria in the blood causing inflammation in the body. But what this particular study did, and I'll try to be real quick about it, is that they enrolled over 161,000 people. And this is a lot. This was in the Korean National Health Insurance System, and they're ages 40 to 79 with no history of atrial or AFib or heart failure. And they collected all their data, their height, their weight, lab tests, illnesses, lifestyle, oral health, oral hygiene behaviors. And so during a follow-up, 10 and a half years later, they found that 3% of the participants that developed AFib and 5% developed heart failure. And after the 10 years, they found that those participants who brushed their teeth 3 or more times a day was associated with a 10% lower risk of atrial fibrillation. And toothbrushing 3 or more times per day was associated with a 12% decreased risk of heart failure. So
get those toothbrushes out and start brushing. Like, I'm still appalled sometimes.
I know.
When very smart adults come into my practice and tell me that they only brush 1 time a day.
Right.
I'm like, no. It's going to be 2. Because it's good for everything. It's really good for everything.
And really, they said, the researchers, they believe that one possibility of the reason it reduces risk is because frequent toothbrushing reduces bacteria living in the pocket between the teeth and gums, and thereby preventing translocation to the bloodstream.
There you go.
So really,
that's that wound I was talking about.
And just it really does make you think. It really does. It makes you think more. And I think this information is so invaluable. Yes. And I know you've been in this world for a long time, and you're passionate about wellness dentistry, passionate about getting the information out there, not only about health, but also about their wellness and the rest of their lives. So,
well, we feel, I know you feel the same way because we've had great discussions about this. We're all going to get older. Mm-hmm. We're going to try to grow older gracefully.
Yes.
I want my brain to go with me.
I agree.
My body might fail a little bit, but I really want my brain to stick with me so that I can have a really great quality of life. I can live my legacy now, but I can also watch my grandchildren and my children become adults and parents and be there for them, because that's what's so important, right? Is that legacy. Right. And the only way we're going to do that is by taking care of ourselves. And if we just realize that there's just some simple, basic things. We've got to eat right. We've got to sleep right. We've got to brush our teeth. I mean, some of those things, it really does make a difference.
Right. It really does for the quality of our lives. Well, I think that's all we have time for today. Thanks so much, Dr. Jill, I love this information so much, and changing people's lives is a beautiful thing you're doing with this show. And I always love being here with you.
Thank you.
Yeah, it's really interesting.
Well, I want us to get excited because in not the too distant future in one of our shows, we're going to be talking about brain optimization. Not just being okay with the way that your brain feels right now, but how to optimize it. And you're going to love that show.
Oh, I am. I know I am. I know I am. The nerd's like, what is that? Anyway, that wraps up and concludes this episode of the Beyond Face Value Show with your host, Dr. Jill Wade. I'm Laura Lewis Edwards, the guest co-host today. And if you like what you've heard, like what you've seen, we encourage you to share the show with other people. Like and share, subscribe our YouTube channel at Stonebriar Smile Design, and click on that Beyond Face Value Show podcast playlist there, as well as search for the podcast on your favorite podcast platform, whether it's Spotify or Apple or others. Thanks so very much for watching. Thanks so very much for listening. Until next time, this has been the Beyond Face Value Show with Dr. Jill Wade.
Also, to help us grow and expand our reach, be sure to like and subscribe to this show on YouTube or your favorite podcast platform such as Spotify, Apple Podcasts, or whatever you prefer. Just remember, it's time to live your legacy now. I'm Dr. Jill Wade, and this has been the Beyond Face Value Show. Until next time.